Hello, this is Dr. Wendy Wood, and I'm going to be talking today about evaluation of the medically complex patient, specifically the older adult patient. So, first of all, some of the major contributors to disease have been identified as physical inactivity and sedentary lifestyle. The most common hospital DC or discharge diagnoses are congestive heart failure, coronary heart disease, pneumonia, and septicemia. As we've talked about before, people are living longer, so they were living with more types of conditions, disabilities, diseases. In terms of evaluating the patients, we then need to take a closer look at other systems of the body. So patients may come in with, for instance, they've had a total hip replacement. We need to look a little bit closer and look at other factors which may be things that they're dealing with. So those are sometimes overlooked. In an earlier discussion, we talked about laboratory values, and I had an attachment that was a few weeks ago, so you may want to go ahead and take a look at that again. But briefly, I wanted to talk about some of the different types of lab tests and the important things that they may identify. So as far as serum enzymes go, those can help identify diseases or conditions like cancer, myocardial infarction, congestive heart failure, or liver dysfunction. They can show the breakdown of muscle tissue, such as in rhabdomyolysis. So some examples of the cardiac enzymes that are tested are the creatinine phosphokinase or CPK, the LDH, and the CPK-MB, as well as troponin. So you have a list of those and what the normal values are. I wouldn't expect you to have those memorized. Typically, when you are looking at the labs, as we know, it does identify in the review sheet if they have a high or a low level. I'd like you to know some of the things like the hematocrit and hemoglobin levels, what would be considered low. Blood lipids, now that would be another risk stratification for cardiovascular disease. Some examples of things that are tested are the total cholesterol, the high density lipoproteins, or the which are called the LDLs, the low density lipoproteins, or LDLs. There's HDLs and there's LDLs, and then the triglycerides. The coagulation profiles, those are important for many patients. So those having, say, total hip replacements or total knee replacements, really anybody on coagulation therapy. So that could be somebody with AFib, somebody with a DVT. Oftentimes it's also for DVT prophylaxis, so prevention of it. If they've had a heart valve replacement, PE, that would be, of course, pulmonary embolism, trauma, and I just mentioned the post-surgery. So that would be very important to know what the coagulation levels are. If they're high, it could be a problem. If they're too low, that could be a problem. With complete blood count, there's a few different things that are tested. With the red blood cells of the RBCs, that's looking at the oxygen carrying capacity. So if things are too high, that is termed polycythemia vera. And so in that case, you would have the risk of clot formation and loss of perfusion to tissues. When the RBCs are low, you could have anemia, so you can get a lack of oxygen to the tissues, which can result in fatigue and disability, cognitive changes, functional loss. So some of the typical things with RBC that are also looked at, as I mentioned, are the hemoglobin and the hematocrit levels. White blood cells, that's looking at the body's response to infection. So when things are high, that's leukocytosis, could be due to an infection. When things are low, that would be termed leukopenia, and that could be caused by bone marrow depression, acute infection, or even alcohol abuse. The white blood cells, the studies are further broken down, to look at the neutrophils, the eosinophils, lymphocytes, to kind of get a better picture. In terms of platelets, platelets aid in clotting and the release of growth factors. So when platelets are low, that's thrombocytopenia, and that could be caused by chemotherapy, a blood transfusion, or it's a little typo there, I'm sorry, a heart valve implant. In terms of what can also cause that is you could get heparin-induced thrombocytopenia. So that's basically from too much heparin after surgeries. So being maybe given too much of that. When the platelets are high, that is termed thrombocytosis, and that could be due to iron deficient anemia, inflammation. IBS would be irritable bowel syndrome, or TB, as in tuberculosis. Electrolytes are another item, and I'd like you to look at table 9.3 of your text. Just kind of briefly, electrolytes are going to affect cellular function, and abnormalities with electrolytes are common in the older adult. So those are things you really want to look for. Things that can cause abnormalities or problems with electrolyte levels are malnutrition, dehydration, meds, organ function decline, infection, and cancer. And those are all things that as people get older, they're more prone to get. Some electrolyte examples: creatinine and blood urea nitrogen or BUN are reflective of renal function. Sodium and potassium are going to affect cellular membrane potential. And carbon dioxide and chloride are going to affect the acid-base balance. Calcium levels being off could identify parathyroid dysfunction, malnutrition, or chronic renal disease. Magnesium's for nerve and muscle function. So many times when magnesium is low, people may have muscle cramps. Low levels could be associated with alcoholism, chronic diarrhea, dialysis, or cirrhosis. High levels could be associated with renal disease, adrenal failure, or dehydration. Okay, so talking briefly about anemia. Anemia is fairly common in the older adults. About 10% of older adults are found to be anemic. It's really important, first of all, to identify what the cause of the anemia is and to be able to correct that. And what anemia can do, of course, it can cause fatigue, cognitive changes, activity intolerance. When anemia is in the presence of CAD, this could lead to an angina, and in worse cases, you can get congestive heart failure. Some of the causes, the most common cause is GI bleeding. Other causes, iron, folate, vitamin B12 deficiencies can cause anemia, renal insufficiency, or chronic inflammation. And again, the RBC levels are an important test for identifying that. And that can be further broken down to the MCV, or the mean corpuscle volume. So that's kind of like the width of the cell itself, or the mean corpuscular hemoglobin concentration. Acid-base balances are important to identify. These problems, the acid-base imbalance, can be due to problems that affect respiration, like, say, for instance, COPD, or even traumatic brain injury, or problems with metabolism. Normal body pH would be 7.4. So if you look at the table on 9.4 in your text, that's going to better identify. But think of problems with respiration. You can have respiratory acidosis, or you can have respiratory alkalosis, or you can have metabolic acidosis, or metabolic alkalosis, or acidosis. So normal pH should be 7.4. So an example of something causing maybe metabolic acidosis would be, perhaps diabetes. In terms of respiration, I mentioned COPD. The reason being is that the carbon dioxide levels are going to affect the acid-base balance. So you can actually get changes in the blood. So in terms of coronary artery disease, that is one of the top causes of morbidity and mortality. So very important to stratify or identify the type of risk the older adult may have. You can do that by the history, looking at what kind of health habits do they have. Are they a smoker? Do they have diabetes? Take a look at, are they obese? Are they inactive? And then looking at some other objective signs like hypertension, and then lab values, abnormal lipid profile, and then do they have a family history of coronary artery disease. In terms of some of the signs or symptoms, angina, so that would be the chest pain, or of course it really could be jaw pain or arm pain, and that would be not related to a musculoskeletal problem. Shortness of breath with mild exertion, dizziness, syncope, orthopnea. So orthopnea is a person needing pillows to sleep, because when they lie flat, they're short of breath. Lower extremity edema, tachycardia, heart murmur, unusual fatigue, and claudication. So the claudication being that pain in the legs as they walk. It's basically the muscles aren't getting enough oxygen. I do want to just mention a particular patient that I've seen recently. Actually, I only saw this patient one time. I was asked to come and evaluate that person for dizziness, since I specialize in vestibular. And by the referral, it looked like it was, a straightforward, vestibular problem from what I was being told. What the referral was and the diagnosis, the person was complaining of dizziness. Well, I went to go see her and came to find that she did have shortness of breath with mild exertion. She was reporting dizziness, but to me it didn't seem like vertigo. And she also had high blood pressure. She was fatigued, very fatigued. And because her blood pressure was so high, I started putting things together and realized I don't think this person's problem is vestibular. Even if it is, the more pressing problem was some abnormal things that I was finding. Her blood pressure was very high. And so I asked her to call her doctor right away. And I called the doctor as well. The family was a little bit hesitant, or they didn't quite believe that blood pressure could be so high, even though, I took it several times. In any case, it turned out I did speak to the physician directly myself, And the very next day, that individual was hospitalized for an MI. So these are very important things to pick up. Many times the older adult, sometimes there are studies out there that report that older adults are a little less likely to report angina, although they may. So it's very important to put all these other things together. This individual was also inactive and she was obese too. So these are important things to identify. I always do take blood pressure. Okay, so you want to also look potentially at factors that might affect the mental status. And we kind of went in depth into this in a prior lecture, looking at dementia versus delirium. So some metabolic factors can cause alterations in mental status: hypoxemia, anemia, hyperglycemia, electrolyte imbalances, dehydration, and malnutrition. So again, very important to look at and to kind of differentiate what was a person's prior level. They may be mistaken as having dementia when in fact they just have a temporary state of delirium. Polypharmacy, we've gone into in depth. You want to make sure you want to ask about alcohol, because alcohol abuse can cause many problems. In terms of seizure, patients can have altered mental status, especially the older adult, from anesthesia or even the trauma of surgery or being in a new environment, or everything really combined. So, as I mentioned, differentiating between dementia and delirium. Okay, so in terms of the heart rate, we want to look at what is the rate, the regularity, and the quality. So rate, of course, is looking at, how many beats per minute. In terms of quality, you may see or you may feel a bounding pulse, which is one that's difficult to obliterate. And it could be caused from exercise. The person might have just exercised and they have a very strong pulse. But it could also be caused by fear, anxiety, fever, arrhythmias, hypertension, or volume overload. A thready pulse is a weak pulse. It's easily obstructed with your fingers as you were palpating. It can sometimes be rapid. Possible causes: arrhythmias, dehydration, aortic stenosis, ketoacidosis, or shock. Heart rate reserve, this is the amount the heart can safely increase from resting value. So what you want to do is you want to look at their predicted max heart rate, and that's going to be 220 minus their age. So then you're going to take that and you're going to subtract the resting heart rate from that. And that'll give you the heart rate reserve. Blood pressure and pulse pressure. The pulse pressure is very important. It kind of tells you about the cardiovascular compliance, or the ability of the blood vessels to be able to expand and contract. And this is a predictor of cardiovascular disease. So what it is you're going to take systolic minus diastolic pressure, and a normal pulse pressure would be around 40. As the pulse pressure increases, the risk of cardiovascular disease increases. Pulse pressure is greater than 60 millimeters of mercury. In that case, you should provide a medical referral. So it doesn't mean that you're not going to see the patient for physical therapy, but you want to have them more thoroughly checked. Orthostatic hypotension, that is defined as a drop in blood pressure when someone's making a transitional movement from, say, supine to either sit or stand, or it could be just sit to stand. And what you would see is a decrease in the systolic blood pressure of 20 millimeters of mercury or more, or a decrease of just 10 millimeters of mercury with a reflexive increase in the heart rate. So you need to take a look at both. Some of the causes: dehydration, medications, anemia, arrhythmias, immobility, sepsis, or Parkinson's. Body weight and body mass index. BMI is important to look at. BMIs of less than 19 have been associated with increased death rates in hospitalized patients. So that's that more frail patient. The problem, though, is BMI doesn't take into account body composition. So very important that you want to get strength measurements. So basically, body mass index, if you don't know what that is looking at your weight compared to your height. So you want to look at what their strength is. Waist circumference is very important to take because increased abdominal girth for women greater than 35.5 inches or men greater than 39.5 inches is associated with risk for cardiovascular disease. 5 main reasons for hospitalization in the older adult are coronary artery disease. Again, why you really need to stratify their risk factors. Heart failure, pneumonia, urinary tract infection, UTI, sepsis, dizziness, and falls. With dehydration, there are 3 main reasons why the older adults usually are at risk. They have a blunted thirst mechanism, they have decreased total body fluid, and decreased renal function. So some important factors to look at that do lead to increased risk also are dementia, history of stroke, urinary incontinence, infection, use of steroids, polypharmacy, and functional decline. Symptoms could be lethargy, confusion, rapid weight loss, and functional decline. I do want to mention metabolic syndrome, also called Syndrome X or insulin resistance syndrome, IRS. And basically, it's a cluster of 3 or more risk factors for cardiovascular disease that are associated with myocardial infarction. So that would be increased levels of triglycerides or increased abdominal fat, low levels of HDLs, hypertension, or elevated fasting plasma glucose. Insulin resistance and abdominal obesity are predictors of metabolic syndrome. When hypertension is increased and BMI is over 27 in those over 40 years of age. So those are important things. That's why looking at the BMI and the other end is very important. With this insulin resistance syndrome, type 2 diabetes is on an increase. Okay, that concludes this chapter. The important point of this is prevention and also looking beyond what the diagnosis the person comes in with. So it may be they're coming in for a total joint replacement, they've had the joint replacement, now they're coming in for therapy, and they may have other things going on. In the older adult, you do need to look at these closely. Okay, well, thank you very much. That concludes this lecture.